Hello, companions. Hello, Mr. Morla. My name is Unidad. On this occasion, I'm going to break down all related with Unidad 5 to 13. Let's begin with the exercise of the Unidad 5. The topic is Medical Practitioners 1. Raising us to describe the work of specialists in each branch of medicine. We got a bit of positive to help you. Dermatology. Dermatology is specialized in the disease of skin. Rheumatology. A rheumatologist specialized in disease of the joints. Traumatology. Traumatology specialized in accident and emergency med. Uh, Pediatrics. Pediatrics specialized in disease affecting children. Obstetrics. Obstetrics specialized in managing pregnancies. Complete disabled is words from A, B, and C opposite to related forms. Put a strict mark in form of a strict syllable in each word. The first one has been done for you. Very known and known. Specialized, specialist, specialty. Practice, practitioner, practice. Consult, consultant, consultation. Assist, assistant, assistance. Graduate, graduate, graduation. Qualify, qualification. 5.3. Five preposition is C opposite that can be used to make word combination with the words in the box. Then use the correct forms of the words to complete the sentence. Good interest, specialized work. Hepatology is specialized in the diagnosing disease to examine cells and tissue. Pediatrician most enjoy working with children. An oncologist interested in diagnosing and treatment of cancer. A psychiatrist must be good at counseling. A neurosurgeon must be good with her hands. 5.4. Make word combination using a word French box. Two words can be used twice. You got a B, you got a B, and C opposite to help you. Consulting, rooms, general, practitioner, group, practice, health, center, internal medicine, surgical, specialty. Over to you. Read what Dr. Jill Matthews says about surgeons in section C. Make a list of the qualities she thinks are needed to be a good surgeon. Then make a similar list of qualities uh, for another specialty. If you are a student, use which branch of medicine uh, do you think you have the quality for? If you have already completed your training, why did you choose your particular branch of medicine? Now, in Spanish. Escribe oraciones para describir el trabajo de los especialistas en cada una de las ramas de la medicina. Mire el lado contrario para ayudar. Dermatología. Un dermatólogo se especializa en las enfermedades de la piel. Reumatólogo se especializa en enfermedades de las articulaciones. Traumatología. Un traumatólogo se especializa en accidentes y emergencias médicas. Pediatría. Un pediatra se especializa en enfermedades que afectan niños. Obstetricia. Un obstetra se especializa en el manejo de los embarazos y demás. Completa la tabla, las palabras de A, B y C, opuestas y relacionadas. y relaciona, coloque una marca eh, de acento delante de la sílaba acentuada de cada palabra. El primero está hecho por el verbo, sustantivo de actividad o cosa. Especializar, especialista, especialidad. Ejercer, facultativo, práctico. Consultar, consultante, consulta. Asistir, asistente, asistencia. Graduar, graduado, graduación. Calificar, calificación. Eh, encuentra preposiciones en la C opuesta a eso. Active, and preposition is your opposite that can. eh, encuentra preposiciones en la C opuesta a eso. Puede ser usado para hacer combinaciones de palabras con las palabras en la caja. Entonces usa las formas correctas de las palabras para completar la oración. Bueno, interesado, especializarse, trabajar. Un patólogo se especializa en el diagnóstico de las enfermedades, examinando en el diagnóstico, examinando las células y el tejido. Un pediatra disfruta trabajar con niños. Un oncólogo está interesado en el diagnóstico y tratamiento del cáncer. Un psiquiatra, eh, un psiquiatra puede ser un buen consultante o un buen entrevistador. Eh, un neurocirujano puede ser bueno con sus manos. Haz combinaciones usando las palabras desde la caja. Dos palabras puedes usar, eh, mira A, B y C opuestas para ayudarte. Consulta. Cuarto, general, eh, practicante, grupo, práctica, salud, centro, interno, medicina, cirugía, especialidad. Now we pass to the Unidad 6. The topic is medical practitioners 2. Make the word combination using a word from each box. Look at B, A, B, and C a puzzle to help you. Associated, specialist, house, officer, on, call, provisional, diagnosis, radio, pager, word, round, uh, match the description by 105 with the job title A, B. Look at A and B a puzzle to help you. Dr. Graham has been a pediatrician for 8 years old and is responsible for treating the children admitted to Ward 6. Dr. Stewart has just started the second year of foundation program. Dr. Singh has started his training as a surgeon. Dr. Philly has just graduated and is working in Alleged Hospital, Birmingham. Grant. Dr. Miller is change of medical staff in Birmingham Hospital, specialist register, medical director, consultant, shop, PRAO, or house officer. Are the following estimates true or false? Find reason for your answer A, B, and C opposite. Medical graduate becomes registered 2 years after graduation. The system of training doctors in Britain is called the Foundation Program. The name Senior House Officer is no longer used in Britain. The consultant is usually The first doctor to see new patients. When working in shifts, all doctors take turns to be on call. Complete the text of a PRA show describing her job. Look at A, B, and C opposite to help you. When I get to the work, the first thing I do is talk to the house officer who was on duty during the last shifts to find out if there have been any new admissions. Then I generally see the sheriff nurse. He tells me if there is anything that needs to be done on guilty, such as intravenous intravenous lines to put up or take down. Later in the morning, I clear any new patients, which basically involves taking a history. On Thursday and on Friday morning, the the consultant does her work around, and I have to make sure I'm completely up to date on her patients. After that, there are usually lots of things to do, like writing up required form for blood test and so on. In the afternoon, I have to prepare for any patients who are to be discharged the next day. They are usually happy to be going home. And then, of course, there are letters and tutorials in the training foundation program on Monday and Wednesday. Down in Spanish. Haz combinaciones usando las palabras en la caja. Mira A, B y C opuestos para ayudarte. Asociado, especialista, casa, oficina, eh, tomar, teléfono, provisional, diagnóstico, radio, página, Word, run. Combina las descripciones con el trabajo. Eh, mira A y B opuestos para ayudarte. El doctor Graham ha sido un pediatra por 8 años y es responsable de tratar a los niños. Eh, el doctor Stead ha estado empezando el segundo año en en el programa de fundación. El programa de fundación. El doctor Singh ha empezado su entrenamiento de cirugía. El doctor Phillips se ha graduado y está trabajando en un hospital en Brigham. El doctor Miller está cambiando de hospital en el, cambiando de, de grupo médico en el Brigham Hospital. Especialidad, registro de especialidad, director médico, consultante. Está, está la especialidad verdadero o falsa. Encuentra la razón para tu respuesta en A, B y C opuestos. Un médico graduado, un médico graduado se encuentra registrado 2 años después de graduarse. El sistema de Training Doctors en Gran Bretaña es Es llamado por el programa de fundación. El nombre de la casa del Señor is no longer, no es usado en detalle. El curso, la consulta es usualmente la primera por el primero que consulta el paciente, que es el doctor, es su primera médico. Cuando están trabajando en chips, todos los doctores toman turno para hacer una llamada. Mm. Completa el texto del PRHO describiendo su trabajo. Mira A, B y C en los huesos para ayudar. Cuando me levanto, voy al consultorio. Bueno, cuando voy al consultorio, la primera cosa que pienso es hablar de, de los pacientes que han estado durante, de los, es hablar con el personal encargado durante el, el personal encargado durante para encontrar en estado la emisión. Entonces, generalmente veo el cambio de enfermedades. Eh, Ellos dicen si ha ocurrido alguna eventualidad, si necesitan eh, alguna eventualidad, si he encontrado alguna eventualidad o si ha sucedido alguna eventualidad. Eh, Luego, en la mañana, recibo pacientes para tomar sus historias. Eh, entonces, jueves y viernes en la mañana, la consulta, eh, estoy, ah, tengo que hacer seguro un completo, una completa cita para ello. Luego, eh, hay muchas cosas en las que pienso hacer, como eh, escribir el tipo de sangre de los pacientes y todo lo relacionado. En la tarde, tengo que chequear algunos pacientes que están para el próximo día. Ya hay muchos días. Ellos están muy felices de ir a casa. Y entonces, por supuesto, hay algunas lecturas, algunos tutoriales en la fundación del programa eh, para el lunes y el martes que debo leer. Now, I'm going to read the 97. The topic is nurses. Read the sentence, look at it, be, and see a positive help. Someone who specializes in delivering babies is a midwife. Someone who is qualified to assist nurse is a clinical support worker. Someone who is not qualified but is able to assist nurse is a nursing auxiliary. A nurse who has qualified is a staff nurse. A nurse who specializes in health promotion is a health visitor. A nurse who looks after a ward is a change nurse. A nurse who works in the community is a district nurse. Some who, Someone who answers the ward telephone is a ward clerk. Main word combination using a word and a phrase from each was look at the opposite to help you. Carry out a procedure, change, address, check the temperature, uh, give an injection, remove sutures. Complete the sentence with the correct grammatical form of perform. And isotope frame scanning painless and easy to perform. Biopsy of the pancreas was performed last March. If the patient condition deteriorates, a laparotomy should be performed. If a diagnosis of meningitis is suspected, a lumbar puncture must be performed. Last year, we performed a randomized double-blind group study. Complete the sentence with the correct grammatical form and the carry out. I now intend to carry out the alleged study. Unfortunately, unfortunately, few properly controlled trials have been carried out so far. A number of studies has been carried out recently to look at look at this question. A right head colectomy was carried out and the patient made a full recovery. That's good. This procedure can be carried out in the emergency department. Over to you. What kind of tasks do nurses carry out in your country? Are nurse responsibility increasing? What are the implications of this? Now we go with the United A, Allied Health Professionals. Make word combination using a word from each box. Look at A, B, and C. C and D opposite to help. Ambulance, technician, artificial, limb, club, food, contacts, links, uh, health, professional, intraocular, pressure, occupational, therapist, social, worker. Which shall her professional could best help the following people? Look at A, B, C, and D opposite to help you. A young married woman who has just had a baby, social worker. A woman who is having difficulty using her right arm following a fracture, physiotherapist. Someone who needs glasses, optician. An elderly woman who has had a below knee amputation, protesting, occupational therapist. A man whose wife has Alzheimer disease, social worker. A man with a fungal infection of his feet, podiatrics, chiropractic. Complete the text, look at A and C opposite to help you. The practice works with patients of all age as a member of a clinical team based at the large hospital. The patient may need prosthesis as the result uh, of an accident or amputation following a disease such as diabetes. Alternatively, they may have be born without a limb. Orthoptists work alongside doctors, nurses, physiotherapists, and occupational therapists to give the people under their care best possible rehabilitation. Their main aim is to enable the patient to lead a normal life at work and leisure. As orthotists often work in a clinic as part of an outpatient service and also visits other centers to provide a service for people with special needs. They deal with people of all age, for instance, children who have cerebral palsy may require splints to help you. Then walk, and many older people need especially choose to correct deformity if damage any parts of the human skeleton may require some forms of orthosis. The orthosis may be needed to reposition the body or to relieve pain. Over to you. Britain is introducing a new member to their healthcare team, called a medical care practitioner (MCP), similar to the physician assistant in the United States or the countries. The MCP will be able to carry out some of the functions of a medical practitioner, such as history taking and examination, and diagnosis and treatment of the certain illnesses, without having a medical degree. What are the advantages and disadvantages of this, your opinion? Now we go with the topic 9, the hospitals. Complete the table with words from A, B, and C opposite. Put a strict mark in front of the strict syllable in each word. The first one has been done for you. Bear, noun. Admit, admission. Assess, assessment. Teachers, discharge. Operate, operation. Refer, referral. Treat, treatment. 9.2. Make work combination using a word from each box. Look at the C opposite to help you. Accurately, ill. Assessment, united. Night. On, duty, referral, referral. Letter. Wait, list. 9.3. Which hospital department would be most appropriate for the following patients? Look at A, B, and C opposite to help you. A woman in diabetic coma, intensive care unit, ICU. A patient who has just had a radical prototomic, high dependence unit. A patient who is to have a skin lesion removed, day surgery unit. A man with a foreign body in his eyes, a gynecologist emergency. A woman with a trained abortion, gynecology emergency. The number 4 is accident emergency. Complete the track from information left for patients. Look at A, B, and C a person to help you. Information for outpatients. When you arrive at the clinical or the hospital, please tell the receptionist who will come you, check your details, and direct you to the waiting area. The length of your visit will depend on the treatment you are going to have. You may need to you may need to have some tests, such as an X-ray, which could mean going to another department, or you may be referred to the other professionals, such as a physiotherapist or dietitian. You may need to be revisit the clinic. Even staff at the clinic want to see you again. Another appointment will be arranged for you. If you need to admit it to the hospital for more treatment, either as an inpatient or for day surgery. You will be told when this is likely to happen. If you do not if you do not need for treatment, you will be discharged to your GP's care. Complete the sentence and look at the opposite to help children over 60. People with some chronic disease do not have to pay prescriptions charged in the UK. A patient with mobility problems may be unable to go out. They are housebound. Patients, the average GP appointments in 10 minutes long. Log means someone who takes the place of a staff member who is on leave. Care outside working hours is known as out of hours treatment. 10.2. Make word combination using a word or phrase for each box. One word can be used twice. Look at A and B apostles to help you change dressings, make appointments, refer patient, run a clinic, supervise staff, take messages. 10.3. Which member of a practice team will be responsible for each of the following? Look at B apostles to help you. Running a clinic for pregnant woman, midwife. Teaching the patient how to strengthen his broken leg, physiotherapists. Letting the GP know that a patient can come to her appointment, receptionist. Running a clinic for people who want to lose weight, practice nurse. Visiting a patient who has just returned home after the hernia operation, district nurse. Carrying out the checkups on children in a poor neighborhood, health visitor. Organizing cover for the absent doctor, practice manager. 10.4. Complete the diary for Dr. Stewart afternoon. Look at A and see if us to help you. From 1 to 2 p.m. practice team meeting over sandwich lunch. Afternoon surgery. 12 minutes appointments. To 4 from 4 to 4:20 p.m. coffee break. from 4:20 to 5 p.m. Check with receptionist for message deal with house visits and repeat prescriptions requests. From 5 to 6 p.m. paperwork, PH referrals to secondary care, admin text, telephone calls with patients, private medical examinations, and 6 funds switch to OLH service. Now we start with the number 11, medical education 1. Medical education 1. 11.1. Match these activities to the stage of medical education in UK, even in their passing. Certain cadavers on the graduate, keeping the law of surgical procedures, observed and performed. Physiotherapists, working for 4 months in accident and emergency to experience this specialty. Foundation program, taking 4 week attachment in obstetrics and gynecology undergraduate, taking an online course on recent developments in cardiovascular disease, continuing professional development. 11.2. Complete sentence. Look at B and C opposite to help you. Just before their final year, students have the chance to take a elective in the hospital of their choice anywhere in the world. Problem-based learning contracts with an approach where each subject is thought separately. These days, letters are often interactive with regular opportunities for the students to ask questions. In clinical attachments, students learn how to treat and manage patients. Students select modules can be a topic from outside medicine, such as four and 40 languages. Dissections of the cadavers is an important part of the anatomy, anatomy component. The medical school at the University of Edinburgh is one of the oldest in the UK. She is a consultant at the Royal, one of the leading pediatrics hair specialists in the country. The Royal College of Surgeons in Edinburgh dates from 1505. We have seminar each week where we discuss topics in a small group with our learner. 11.3. Matches of these activities to one of the components of the undergraduate course described B and C opposite. July spends 6 weeks working in a small hospital in the Himalayas. Overseas elective. A group of students discuss together the possible reason for abdominal pain after meals in an obese 44 years old male, problem-based learning PDL. A small group of students raised a pulmonary artery in a cadaver dissection. Other spends months working in the pediatric ward of the local hospital. Clinical attachments. And learns how to take blood from elderly patients. Clinical skill. Who must choose to study travel medicine in his fourth year? The students read more. Now, the Unit 12, the topic is medical education 2. Let's begin. 12.1. Complete the phrase with verbs from the box. Two phrases can be completed in two different ways. Look at 10 and be the puzzle to help you. Access, deliver, demonstrate, provide, supervise, take. Demonstrate the competence or how to do something. Supervise trains by ensuring she successfully uh, completes her training. Deliver or provide course or a training program as a teacher. Take. Take a course or a training program as a student. Assess. Progress or competence. Demonstrate. Assess or demonstrate. 12.2. Match two parts of the sentence. Look at A, B, and C are possible to help you. And if J1 is a doctor, D. A demonstrator is an atomic teacher, H. Clinical trainer is a consultant, F. A supervisor is a consultant, V. A medical school is G. A placement is C. College is A. A fellow is a specialist E. Now here the, the continue. A body of specialists responsible for delivering and assessing training in their specialty. Responsible for the training program of a trainee. A period spent as a trainee in a hospital or a general practice. In the first years of the phone program, who has reached the highest level in their specialty, who provides training during periods of direct clinical care. Part of the university is responsible for medical education. Who teach these sections? 12.3. Writing for the qualifications of the doctors and surgeons. Look at C opposite to help. Mr. A. H. John Husband, MBCHP, FRCS, Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of Surgery and England, Fellow of the Royal College of Surgery of England, Doctor C.V. Cool, Bachelor of Medicine in Science, Doctor of Medicine, member of the Royal College of Physicians, Mr. E. English, Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of Physicians, Dr. E. Meriwether, Bachelor of Medicine, Doctor of Medicine, uh, Fellow of the Royal College of Physicians. Now is the last, the overseas doctor. Let's begin with this exercise. What kind of registration might these doctors obtain? Look at A, opposite to help you. A newly qualified Spanish doctor, provisional registration. A newly qualified Nigerian doctor, limit registration. A doctor who has successfully completed the first foundation year, full registration. As SHO, who has successfully completed the foundation program and gained a certificate of completion of training after several specialist register posts, especially registration. 3.2, write the abbreviation in words. Look at A, B, and C are possible to help you. Any doctors who want to work in the UK must register with the GMC, General Medical Council. Some overseas doctors must pass the PLEB test before they can register. Professional and Linguist Assessment Bureau. Part 2 of the test consists of OSCE, Objective Structure Clinical Examination. In an emergency, remember the ABC protocol, airways, breathing, circulation. Before you can obtain special registration, you must have CCT, Certificate of Completion of Training. 13.3. Complete the test. Look at A, B, and C are possible to help you. My name is Musa. I'm come from Yemen. I came to the UK about 2 years ago after graduation. Because Yemen inside the EEA, I could only obtain limited registration with her GMC at first. It was very difficult for me to obtain a place on a foundation program. Although I speak good English, I had to take the PLAB test to show that I could work safely in the UK. If I had to give some advice to other candidates, it would be that counseling stations you shouldn't simply memorize a set of phrases. It's better to really think about what you are saying to the actor and get the intonation right. After completing my year's clinical training, I was able to obtain full registration, but I found it difficult to get a SHO post in my chosen specialty. Pediatrics as hospitals now have demonstrated there isn't a suitable candidate from the EEA. Once I've completed my second foundation year, I should obtain a CCT, which will allow me to proceed to especially registration with the GMC, an important step on the road to becoming a pediatric consultant. That's all. Thank you for listening.